Dr. Michael Freeman. I'm Associate Professor at Bond University and work on the Gold Coast and dermatology, and I've been in dermatological practice for 15 years now. My special area of interest is with lasers and sun damage, including skin cancer. The important point about skin cancer is that tragically, if it strikes early and aggressively, it can be fatal. And this is where melanoma is a particular problem, because it can affect very young people. And these are people who have genetic susceptibility and have usually had too much UV radiation. As far as UV radiation is concerned, of course we do need some UV. Most people tragically don't realise how much we need and exactly what time of the day we need it. It only is useful coming down in the middle of the day between 10 and 2, because that's when the UVB radiation comes through. That's what makes vitamin D in our skin. In a place like Australia, and particularly here in Queensland, we have a great deal of UV radiation, so that we don't need to have very much sun very often on exposed skin. Skin that's been protected by a sunscreen won't generate vitamin D. So here in Queensland, probably 5 minutes on the skin between 10 and 2 once a week on a larger area of skin would be more than enough to make all the vitamin D that you need. I think it's important when you look at people who spend hours and hours out in the waves, they will often have very tan skin. Now, tan skin protects the skin from UV radiation, so therefore it's actually going to also make it more difficult to generate the vitamin D. So a tanned individual will need more exposure than an untanned person. And don't forget, there are some people that aren't able to tan. They usually have the type 1 or 2 skin, and these are the patients who really need to be very well protected from the sun, but with that balance. Now, if it's not possible to get a little bit of sun safely, then the idea would be to take vitamin D supplements. I think the impression is that for some patients, some people in the general public, the notion of sun damage is a little bit more nebulous. But in an area such as Queensland and Australia with such a high incident UV radiation, everyone knows about sunspots. These are the common term for solar keratosis or actinic keratosis. Now, we all know that these are generated by UV damage, DNA damage in the skin over a period of time, and that they are pre-neoplastic, so they predispose an individual to more aggressive lesions in the form of particularly squamous cell carcinoma. The most important part of the treatment of solar keratosis is to prevent excess UV radiation on the skin. So that's part one. Once you've removed the push to more solar keratosis, then you can start to clear the keratosis. And there's a whole raft of treatments that we have available. It will depend on whether there's a single keratosis or a field of actinic keratosis. So that for a field of actinic keratosis, it's much better to use a field treatment. And we have a variety of these. When there's a large number of solar keratoses in a field, so what we're talking about is a high density. So if you move from one keratosis to another, it'll be perhaps only millimeters or a centimetre between individual lesions before you get to the next and subsequently next lesion. Now, in a field such as this, there's a high likelihood that fairly soon you're going to be generating some further solar damage and therefore squamous cell carcinoma. So that by removing all of those keratoses, you will prevent skin tumours from forming, and also very importantly, you'll be able to observe the small tumours that were perhaps more hidden by the number of keratoses visible on the skin. The knowledge of solar keratosis is advancing all the time, and so too are the treatments. So we have a range of treatments that are available as far as patients are concerned. We have physical modalities, we have chemical modalities, creams, lotions, and cryotherapy. So that all of these can be used to clear patients effectively. One of the newest agents that's recently been developed is a plant extract, and this has shown great promise to clear solar keratoses. I think the communication between doctors and patients is very important, and it's vitally important that it's a two-way communication and that patients and the doctors feel comfortable that they are communicating accurately. The GPs that are in areas of the world that have a low incidence of solar keratosis obviously won't have the same experience as the GPs that have a higher incidence. But always it'll be the dermatologist that has had the most experience with solar keratosis, and thus can give a much more balanced view of which treatment might be best for that individual patient. As far as ability of and the willingness of GPs to refer to dermatologists will depend on the individual practitioner's level of expertise, and also the importance that they put on the condition, say, of solar keratoses. The reality is, for most patients, if they have solar keratosis, they have had a significant amount of solar damage, and they are at risk of tumours, not just directly from the solar keratosis, but also melanoma. Families that have relatives with solar damage are much more in tune with how the damage is created. Unfortunately, the younger members of the community feel always that they're bulletproof and are not able to necessarily moderate their solar exposures when they're very young. This is a problem that we've been trying to address in Australia for some time with the Slip Slop Slap program, and it has had some effect. We're starting to see a slowing now. In schools we have a no hat, no play policy, and this is starting to really take effect in many, many cases. Tragically, until really an individual is affected, it's very hard to have the drive and ability to really affect their own behaviours. It's very important to get the balance right as far as the exposure and relative protection. It's interesting that as a profession here in Australia, we did very much what Europe and Britain are doing at the moment, tended to polarise away from sun exposure, saying keep away completely from the sun. And unfortunately, that's created a whole new set of problems with vitamin D deficiency. So I think the knowledge that a small amount of exposure to UVB in particular, through the middle of the day does lift the vitamin D and therefore protects you against skin cancer, including melanoma, is very, very important. Now, it's a very small amount of sun exposure required here in Queensland. You'd have to check with other areas in the world as to how much they require. But it's interesting that when you go to a park or a garden in the UK, you'll often see some of the office workers stripped down in their underwear, lying out there baking, and everyone previously said, oh, they're crazy, they're mad, but in fact, if they were there for just the right time, they may be the clever ones. It's the ones that head off to south of Europe, Spain, so forth, lying on the beach, getting red and burnt. They're the ones that are really need the education. They're the ones we need to pull back to balance. It's a very important point you make about sunblocks. They have an SPF value, which means that they cut back and filter out the UV. But interestingly, they work like a filter, so that although they're on, they are still allowing some UV through. And so therefore, you're not bomb-proof with sunscreen. You still need to be wary and protect with the amount of exposures that you're exposed to. Can't beat clothing. If you can't see clothing, can't see through clothing, then it tends to be very, very good UV protector, much better than a sunscreen. Always, as a profession, we try and do what's best for the patient. So that what's best for the patient is to completely sun protect themselves so they don't overexpose, and therefore they probably wouldn't even need to come to a dermatologist in the future. So it is actually doing us out of a job, but that is our job to try and make them better. So that's the appropriate way to go. What's interesting is that most people don't realize that the sun also ages them, and so this is something that's only just being realized throughout Europe and America. We've known it here in Australia for years that people look so much older when they have too much sun exposure, and that's another thing to consider.